Hello, I'm Dr. Bernie Rubin from Henry Ford Hospital, and I'm reporting live from RWCS 2017. We have some very interesting poster presentations that I'd like to review with you. Here's Dr. Simon.
My name's Tommie Simon. I'm from the University of Oklahoma, and I'm a first-year rheumatology fellow.
Thanks, Dr. Simon. I've noticed here with your poster that you're talking about hydralazine induced vasculitis. Now, we know about hydralazine and drug-induced lupus, but how common is this situation?
It's relatively uncommon. However, there have been case reports describing hydralazine-induced ANCA-associated vasculitis. We've seen about 2 within the past 5 years, actually.
Well, now I'm worried that maybe I'm missing these cases. So what would I do to be more aware of this problem?
So anybody that comes in with a vasculitic picture with positive ANCAs, especially MPO titer, those patients are the more likely to have drug-induced drug-induced ANCA-associated vasculitis. And in these cases, actually, the drugs that are actually known to cause ANCA-associated vasculitis are levamisole, which can be used to cut cocaine sometimes. So I would consider doing a UDS on those patients to rule out cocaine-induced ANCA-associated vasculitis. Yes, just to see if there's any cocaine use in their history.
And what is UDS?
Urine drug screen.
I understand.
And then, as well as procainamide and hydralazine, those 3 drugs, you would always want to review their drug history just to make sure that there's no drugs that could be causing this vasculitis.
Well, then, once we've made the diagnosis, is there anything that we need to do besides simply stopping the drug?
So in this case, the patient actually presented with diffuse alveolar hemorrhage. So we treated him as ANCA-associated vasculitis, and we actually stopped the drug, but we actually initiated Plex because he previously had a renal biopsy that showed immune complex deposition, so we really couldn't rule out Goodpasture syndrome. So once anti-GBM was ruled out and negative, we actually stopped Plex, gave him rituximab, and just treated him as if he was a regular ANCA-associated vasculitis.
And the outcome, how did he do?
He's actually doing well right now. He had a prolonged hospital stay because he was intubated, but he's actually in a nursing home right now doing well.
Very good. Thank you very much for this very interesting case presentation.